Well, so tell our listeners and viewers, Janet, a little bit about the history of Moses Lake Professional Pharmacy and why 20 years ago we actually were pioneers and stopped billing insurance. And we were called crazy. We were told by families and friends. We were told by even some of our employees that we wouldn't be in business much longer. And 20 years later, many of our colleagues have went bankrupt trying to cash flow an insurance-based practice. And meanwhile, we have 20 years later, we're thriving and we love what we do. So tell our listeners and viewers, Jan, a little bit of history about why we stopped billing insurance in 2002.
Sure. Well, from a business standpoint, it just didn't make any sense to keep billing for something that I was waiting to hopefully be paid for within 90 days, which is crazy because I've already had to replace my inventory. I've already had other clients that need the product. And then hopefully you won't be audited and have to refund, even though the product went out the door and the patients consumed it because the insurance company decided it was not an approved product for that client. And so on my end of it, just financially, it made no sense at all. The other part of it is that the interference that was happening between the prescriber, the doctor on the health professional side, on what they thought was the correct treatment was being disrupted. It was the insurance company telling the provider what service had to be offered. And that just didn't sit well with me because I feel like sometimes if we take the step of that out of the equation, the amount of time the client spent getting treatment, the appropriate treatment, the quality of that service, and not having to wait, it just didn't make any sense to us. So we just decided that, we're going to step out of that box and we're going to practice like patients have been treated for thousands of years. We didn't have this type of service prior to Medicare and Medicaid. So why not act like we had been throughout history? Why not go back to our roots and actually treat clients up front? And what it meant to us is that we had to look at our pricing strategies and actually offer a service that was fair to the consumer and that they would agree to pay. And it's worked out beautifully.